I'm Raluca. I'm 38 years old. I work in aviation industry. I've been married for the last 2 years and I'm 1 in 10 and I'm suffering from endometriosis. I was always looking for effective ways that would impact endometriosis awareness, and that's why I'm here. I was diagnosed with this disease at the age of 21, and I must say that the selection criteria of doctors and hospitals, it's vital to avoid unfortunate incidents that I have gone through. My first surgery was done in 2009, followed by 3 other surgeries throughout the last 9 years. The outcome was I had one of my kidney removed, 1 fallopian tube and bowel resection. In the last 3 years, things got more complicated. Monthly visits to the hospital became a routine, followed by multiple medical prescriptions in order to manage pain. Dr. Ghassan was recommended to me by another doctor, and thanks God for that. I'm considering myself very lucky as I have managed to find the right treatment at Zahra Hospital. I was really impressed with the multidisciplinary approach towards my case. Dr. Ghassan never for a moment treated me just for the sake of treating me. He took his time explaining to me what was his plan, what were his expectations, and he would only listen to what I have to say. He then developed a battle plan and included other doctors, as he was suspecting that my endometriosis affected other areas in my pelvic floor.
So what we see here, we have done vaginal gel packing, and there is the posterior vaginal septum. It's hypointense and thickened, and we have the thickening of the sigmoid colon, and we can see it's extending over a length, and the ovaries are adherent to it, and we have endometrioma also. So we have definite involvement of the colon and the posterior septum here.
So what do you think, Dr. Maher?
I think if I understood correctly, based on this earlier cut, it seemed with the bowel involved, and most likely we're going to need to resect a portion of the rectum and the colon to ensure that all of it is removed to give the patient the best possible long-term relief based on these images.
Yes.
So
it's extremely important to realize that this is a fertility-seeking patient, so we have to also evaluate the ovarian let's say structure, because she has a large endometrioma also involved.
Absolutely, she has large endometrioma.
see a very complicated case of deep pelvic endometriosis.
I'm quite anxious about the surgery, as this surgery is going to be my 5th surgery and it's going to be the most complicated one from the last 4. But I'm keeping positive that the doctors at Zahra Hospital Dubai, they're going to be doing a great job.
In the case of Raluca, and having lived with the pain symptoms for 10 or 15 years and knowing the severity of the disease, the surgery that was conducted and done together with Dr. Maher as our colorectal surgeon, and based on the imaging findings that were diagnosed prior to the surgery, it all gave evidence that the surgery was a complete success. So basically, after the surgery, we as a team, as surgeons, that we knew that we were facing a very risky and complex surgery, and the patient, who was, of course, extremely anxious and extremely worried after having underwent so many surgeries before that have failed and not given any hope of that there might be any treatment for this. The outcome of the surgery, and most important, the relief of the symptoms and the satisfaction of Raluca after the surgery, just give us hope and confidence that we need to continue on this line of working together as a team and with the patients to provide a higher level of management for cases like Raluca's case of severe endometriosis.
I was really impressed that all the doctors were so much aware about endometriosis, from the doctors who perform my ultrasounds, MRIs, to Dr. Maher Abbas, the colorectal surgeon, who's just amazing and equally dedicated.
So this was really a very complex case of deep pelvic endometriosis in a young woman who already had previous surgery that did not resolve her issues, and she continued to have infertility problems in addition to symptoms of pain and constipation. When the patient was referred to my colleague Dr. Ghassan, as any complex case in the pelvis, we work as a multidisciplinary team here at Al Zahra. Now, this patient did undergo a laparoscopic procedure. It took us a few hours in the operating room. We were able successfully to remove all the endometriosis from her pelvis and resect a segment of large bowel that was involved by the endometriosis, and successfully were able to rejoin her intestine together without the need for colostomy. The surgery did go very well. There was very minimal blood loss, and the patient had uneventful recovery in the hospital, and subsequently she had full healing with resolution of her symptom. And it's very important, however, to always tackle these complex cases as a team, because sometimes it's beyond the capability or the skills or the knowledge of one single specialty. So we bring to the table colorectal surgery as a specialty to deal with the component of the pelvis that involve the rectum, the anus, and the colon, but as well as a gynecologic expertise as well, with a good understanding of the disease process of what needs to be done the day of surgery.
I can say loud and clear that with all the issue experienced, Al Zahra Hospital Dubai is the only hospital that provided me with a proper plan to address endometriosis, and my case was taken as a very serious disease. I was finally blessed with this positive experience after the endless sleepless nights and intolerable pains. I'm now fighting for my life, and I want you to get in the fight.